Now, millions of people have health problems related to excess weight. In the previous episode, we discussed the role that obesity has in the development of metabolic diseases such as diabetes, high blood pressure, and heart disease. The solutions to reducing weight are far from one-dimensional, and that's why today we'll be exploring a multidisciplinary approach to achieving holistic weight loss, starting with medical interventions. And joining me in studio for this discussion is Dr. Mark Opperman. Now, Mark, medical interventions, when the average person thinks of weight loss, they think, right, you've got to get on a diet, you've got to change what you eat, and you've got to do some exercise. Why would we be looking at medical interventions?
Simply because obesity and weight gain is a chronic disease, just like hypertension and diabetes. And therefore, you need to treat it as such. The causes of obesity can be multifactorial. There's a genetic component, there's a diet component, there might be medication that's involved in this, lifestyle plays a role, and then other comorbidities, underlying conditions can also play a role. And here we're looking at thyroid dysfunction, hypothyroidism, often a problem, cholesterol in itself or dyslipidemia plays a role in this factor, your microbiome plays a factor. When we take a look at conditions such as anxiety and stress, which can lead to comfort eating, etc., etc. So, Michael, it's a very, very complex disease, and you cannot do this on your own. And medical intervention will be required for the majority of people that battle with being overweight. And it's not 3 or 4 kilograms. Here we're talking a body mass index of above 25, and then obese, these are people that sitting and needs to lose 15, 20, 30, 40, 60 kilograms. That's different.
So, Mark, people who might be dealing with these conditions, if they do go on some sort of extreme diet and they achieve the weight loss, and then they talk about that yo-yo effect where suddenly it all comes back, that's because they're not dealing with the underlying health conditions, correct?
And going on a crash diet, just doing calorie restriction, you're going to create further problems. You're going to create hormone imbalances. You're going to create nutrient deficiencies and malnutrition. And they're not sustainable. The body goes into a stress reaction. And what happens then is you start releasing cortisol and other inflammatory hormones and cytokines, etc., and that causes further problems. So you need a planned approach to weight loss.
Right.
And for me, it starts with, identifying the problem. What is the underlying cause? What is contributing to the underlying cause? It might be a dysbiosis, a microbiome that's not functioning. It might be a psychological state. It might be that you have diabetes or insulin resistance, which you didn't know of. And that needs to be addressed. Things like iron deficiency, which will lead to decrease in your thyroid function, or vitamin D. All of those play a role. Or you might be thinking that I'm eating okay, I'm eating a little bit of food, and you're eating too little, and the body goes into stress. So, and when it comes to these new weight loss medications, that's our biggest problem. Because it's formulated to decrease calorie intake, we tend not to eat enough. And even if you eat, you get full quickly. Now you go into nutritional depletion. And that will stop you from losing weight, because the only thing that you're losing is muscle.
How do these interact with the broader conditions that people might be experiencing? And also, how safe are they? Are they a crutch to weight loss, or are they an aid to weight loss? And are they being, I suppose my question is, are they being abused in some way?
Michael, I think we need to understand that weight loss medication is not something new. We've had drugs on the market for many, many years, for 30, 40, 50 years. And a couple of years ago, I can't give you the exact date, they formulated a new drug to treat diabetes. And then they saw, oh my word, these GLP receptor antagonists or agonists cause weight loss through its action that it has on hormones that manage metabolism, like leptin and ghrelin. And this diabetic medication was then re-registered under a different name.
Okay.
You can't have a medicine under one name for two different indications.
Okay.
So it's exactly the same diabetic medication under a different name that we start using for weight loss. In South Africa, one of them is registered. Okay, liraglutide is registered specifically for weight loss. Some of those other ones that we have are your semaglutides. I'm not supposed to mention them, but I am going to. Ozempic, everyone knows it from social media. Semaglutide, weekly injection. Your liraglutide is the diabetic drug, is Victoza. And the weight loss one that's registered in South Africa for weight loss is Saxenda. And then there's other diabetic medications that works on the same way, like Trulicity, etc., etc. There's a couple of new ones coming in. Now, they work by making you feel full quicker when you eat.
Okay.
Okay? And the second thing that they do is they delay emptying of a stomach. So it's wonderful for calorie restriction, but they can work so well that you don't eat enough.
Okay.
And then you go into a nutritional depletion. These medications are safe. The problem that we have at the moment is because they weren't available due to worldwide shortages, that there's so many counterfeit drugs flooding the market.
Okay.
And that's incredibly dangerous. All the reported side effects and deaths were from these medications, and the CDC and the FDA and the World Health Organization have put out lots of warnings about these things that people buy online. This is prescription medication. You can only get it with a prescription from your medical practitioner, and you can only buy it at a pharmacy. You cannot buy the stuff online. You don't know what you're getting, and they're dangerous. If you are one of these ladies that just quickly want to lose 4 kilograms, this is not the drug for you. You have to use something else.
And Mark, this, as you say, I mean, it's not a quick fix for someone who wants to lose a couple of kilograms to fit into a dress. But can it be, is it used as an effective tool to kickstart a process, to get you on track for weight loss?
Absolutely. This is a way to make lifestyle changes easier, sustainable.
Okay.
But you have to do it right. You have to eat right. You have to exercise.
Right.
It's quite important.
And Mark, in terms of people who would be using these drugs, is this something that you should be undergoing a proper series of tests so that your doctor knows exactly what's going on internally?
Absolutely.
Okay.
Remember, this forms part of metabolic management. So we really need to understand what is happening with the metabolic state. Cholesterol, iron, vitamin D, insulin, glucose levels, etc., because these medications can affect them. Also, we need to understand what other underlying conditions you might have, or what medication you might take. These drugs are good. I almost want to call them miracle drugs because they work on so many other stuff as well, from rheumatoid arthritis to even some kinds of addiction. But they need to be used appropriately, under medical supervision, as part of healthy lifestyle change.
Somebody who might want to get in touch with you to find out more about this, where do they get hold of you?
We're based in Bryanston, Johannesburg. The number is 010-824-1393. But we treat patients all over South Africa. Our website, www.thetclinic.com.